I am Dr. Venugopal. I am the Director of Emergency Services under Aster DM Healthcare. Yes, recently the last week, Aster Group released an interesting app for the public. The idea behind the app is, as you know, Aster Group is celebrating its 30 years of compassionate service, this globally. And part of this, Aster Group decided to give more for the society. And we also identified like a lot of people died on the road due to the cardiac arrest or road traffic accident without getting the primary aid. And even in home, sometimes like due to the lack of knowledge, lack of care, many people are end up in a wrong way of treating patient. So Aster Group thought that if this can it be preventable, and then the solid things like these thoughts is mingled or like linked with the technology. So now like almost everyone will have like a mobile phone with a net activity, and the Prime Minister dream is also like every niche and corner has got this facility. So like a simple app will bring some solution. So this at the same time Aster Group has got a big background, particularly in Calicut and Calicut, Kottakkal and Kochi units. A couple of years, and also like in the last decade, we trained a huge number of people. Literally it is more than 2 lakh that trained people database is with us. So we thought like to enroll and convert this database into a volunteership. It is going to be help for the community. Definitely like this group are scattered. Some people are in India, some people are abroad, somewhere, it's all there. And but it is a Herculean task to bring into the volunteership. So based on that, we developed an emergency app, and this emergency app is 2-3 dimension is there. One dimension is like first of all like we will enroll the trained volunteer in the app. This enrollment is very simple. Someone is trained for like the basic life support and primary first aid. This training duration will coming about 8 hours, and they can very well enroll. And once they for enrolling, they have to download that responder app, and through the responder app they have to register their name, which require their name, email ID and phone number. Once they register, they will get an OTP, and through the OTP our admin will look the credentialing of the volunteer, whether to be like enrolled or not. If this is there enrolled, they will become they will appear in the route map. The system is working something like the Uber system is working, and someone is like having an issue, a medical issue or a medical emergency, they can put the call, or they can alert and they can raise an alert or encounter through the app. Once they raise the alert, immediately like they can say, this will go to the admin, and they will see, admin will allocate the person to this. At the same time, they can also see that in the Google map, they can also see that volunteers around them. And once they raise their call, this volunteer, if the volunteer is willing, they can accept it. If don't willing, okay, they can decline it. Once they accept it, immediately they will move to the person who required the help, and they will give the primary level help. These volunteers are laymen who received 8-hour first responder level training. So they will do the primary first aid, including cardiac resuscitation. So someone is in cardiac arrest, they will do that hands only CPR or complete CPR, and by that time it will be linked to a transport system, either through the ambulance or whichever is the vehicle available. So this is the way like the system is working. At the same time, like if you have an elective or semi-emergency system, you can register you can download and register your complaint, etc., etc. you can do. But something you are facing a dire emergency, Yes, you can just put it, there is an SOS button. Once the put is the SOS button, directly you can call the volunteer and you can settle out the issues. And this is the working system. Yes, this is like two, three very important challenge when we face when coming into the system. Like I told you, like we have a large number of trained people, already trained people, but it is I thought that initially like we can very easily pick up and then enroll into, but in reality it is not so easy. Because these 2 lakh people train over a decade, from the like last 10 years, but many of the people may not be remember at all what they trained in those times. So like I have to redo everything. That is a big, so but it is not a problem, because the redo means science is also developing, lot of new developments are coming. It is not an issue, it can very well do that. Then sometimes like many of the people, they whatever the database and phone number with this, now it is changed. People are changed number to this and that. So these are the other areas. Second one, like when the app is working, one important things like if you don't have net, it will not work. Internet is a mandatory thing. And also like both the victim as well as the responder, both of them should have that net connectivity. These are the 2 major challenges that I am facing. I don't think it will make any legal comment. Nowadays, like the recent Supreme Court verdict, the Good Samaritan law and all, it is all like all this doing it with just like a Good Samaritan. It's the only intention to help the people. And on top of that, this app has got a medical direction on top of that. If the volunteer is approaching a victim to save someone, and if he is having some doubt, there is a 24-hour qualified emergency physician is online, on telephone. They can directly call, even they can pass the visuals if they want to our consult center. So that we can, it's like anyway, it is an initiative. When we are moving forward, then only we will know like further issues. But absolutely, like in Indian scenario, huge population and a lot of need, and it is a innovative things, and it will save several lives. That's what I believe. Definitely, we will incentivize in terms of their work, not in terms of money. It is purely a voluntary service, but like this training itself, training otherwise it is a cost. All the training we will give free of cost. Apart from that, someone is like volunteering, we will give like a valid certificate, valid badge, etc., etc. And someone do a good job, yes, that kind of people we will recognize separately, and we will incentivize. What incentivize, that we have to sort it out, but definitely it is something will be commendable. This like initially we will start with a volunteer base or like a first responder, but over a period of time, once the base, what we want, like this is not only in Calicut or somewhere, we launch nationwide. So in India itself, Aster Group has got 10 hospitals, 4 in Kerala presently, 4 in Kerala, 1 in Bangalore, then Kolhapur, then Guntur, Vijayawada and Hyderabad. All these centers will focus, and at least like 10,000 to 20,000 volunteers will be there around that hospitals or that institution. They need not be again, like when we are launching the app, it is purely a community based one, and we are not asking the people to bring the patient to the Aster Group. They can take the patient to any hospital they comfortable. So that is the most important thing I want to tell, because it is launched by a corporate. So as it is launched by a corporate, a blame will come. This is a business trick, bring the patient to Aster Group. It is absolutely not like that. I don't know whether it will be bringing entirely patient. That is not there. But we are like this app is to save lives. Yes, this is very important. Like just recently one of our MP, E. Ahmed, died in our parliament, And when I am studied in detail, it shows that the lack of certain primary emergency care even in parliament. So the even if it is absent in parliament, and where like all our decision makers are sitting there, they are under stress and strain. So they really like they are prone for this kind of heart attack and all this. So where from, if this is lacking there, when coming down to the primary healthcare, it is absolutely zero. So definitely like what we can do, like each and every primary health center and related area, we can train people and they can enroll them. That's definitely will do. That's a word from Aster Group. We'll do that.